Hi there, I'm Dr. Kushleen Jaggi. I'm a board certified nephrologist, in other words, a kidney specialist. And today I will be talking to you about some of the signs you should watch out for that would indicate you're developing kidney issues. So let's get started. Now, did you know that about 37 million adults in the United States are estimated to have kidney disease? That's 1 in every 7 adults. And as high as 90% of these people don't know that they have any kidney issues at all. And so that's why I wanted to make this video so that you can take a more proactive approach and seek care early on in the course of the disease. In order to understand the signs of kidney disease, it's first important to know what our kidneys really do, and then it's easy to understand what happens when something goes wrong with them. So structurally speaking, the kidneys are two bean-shaped organs that are roughly 10 to 12 centimeter in length, which is the size roughly of your fist. They're located at the back of your abdomen, right below the rib cage on either side of the spine. Our kidneys perform many critical roles in the body. They filter waste products, as most of us know. In order to do that, our heart pumps a major chunk of the blood into the kidneys. About a fourth to a fifth of the blood that's pumped by our heart goes into the kidneys to be cleaned every minute. So in a day, about 1,500 liters of blood flows through the kidneys to be cleaned every day. That's about 400 gallons of blood. Now, all of this blood is crossing these smaller channels within the kidneys that are called nephrons. And actually, that's where the word nephrology comes from. Nephronology, nephrology, study of kidneys. These smaller nephrons within the kidneys that act like a sieve and continuously clean your blood. Now, some people ask me, what are these waste products that the kidneys filter out? So these waste products are essentially the breakdown products of the food that we eat. It includes any toxins, any drugs or harmful substances within the body. Now, along with that, pretty much all the cells in our body are constantly dying and being replaced by newly synthesized cells. So the kidneys, they filter the waste products that are generated in this whole natural cellular turnover. Now, in addition to that, the kidneys also maintain electrolytes and chemicals within our body, like the sodium, potassium, calcium, phosphorus, chloride within range. They also maintain the acid-base balance in the body. So for example, you eat something that has extra acid in it, the body through the kidneys eliminates that extra acid in the urine in order to maintain the pH within the blood, or in other words, the acid-base balance within the blood. Now, this function, not many people know. Your kidneys also produce hormones within the body. Some of the hormones that our kidneys produce include renin, active vitamin D, erythropoietin. Renin hormone maintains blood pressure within the body, and active vitamin D, as you know, maintains your bone health. Now, erythropoietin is a hormone that stimulates RBC, which is red blood cell production within the body. And so you hear about its abuse by some of the endurance athletes that use it to boost red cell production in the body. Your kidneys also maintain the fluid balance in the body. So the kidneys decide how much fluid needs to stay in the body and how much it needs to get rid of. And so, for example, if your body has extra fluid, your kidneys will produce dilute urine and get rid of that extra water through the urine. Versus if you're out and about on a hot sunny day and getting dehydrated, the kidneys retain as much fluid as it can to prevent dehydration and prevent your blood pressure from getting low. So now that we understand what our kidneys do, it's easy to understand the signs and symptoms one may develop when they have kidney disease. And that's very important to know, because you can then seek early care and prevent permanent damage to the kidneys. Now, there is a big misconception. Most people think that, oh, they have pain in their back and that might be related to their kidneys. Most cases, that pain is muscular in nature. Kidney problems mostly don't cause any pain in that area. There are a few causes where there is pain related to the kidneys, but those are not very common. And those can be related either to, say, polycystic kidney disease. That's a rare genetic disorder that runs in families. It can be related to kidney stones and can be related to a kidney infection, which is not a UTI that's only within the bladder. The pain will be in that area if the infection has traveled up to the kidneys. Some people might notice frank blood in the urine, which is just red bloody urine or clots of blood in the urine, while others may not see any blood in the urine, but it's seen on the microscope when your doctor sends your urine for testing. Other patients might notice foamy or frothy urine. So normally there should not be any protein in our urine. But when the kidneys get damaged, whether from long-standing diabetes or blood pressure, there can be leakage of protein in the urine. So the filtering system within the kidneys gets damaged and starts to leak the protein from our blood into the urine. And now when that protein finds its way into the urine, it starts to create those foamy bubbles on the surface of the urine. As we discussed earlier, the kidneys also get rid of the extra fluid from the body. And so when the kidneys get damaged, they're unable to get rid of that extra fluid in some patients. And so some people notice puffiness around their eyes or fluid building up around their face. They might notice some problem breathing because the water is accumulating in their lungs. Other patients might have just distension of their bellies and notice that their pants are getting tighter, while others might notice some swelling in their ankles or around their legs. One of the other things we talked about was that the kidneys clear the waste products from the body. So what happens when the kidneys are not functioning well and the waste products start to build up in the body? These waste products actually initially don't cause any signs or symptoms. Our bodies get used to it, they acclimatize pretty well to it, but later on in the course of the kidney issues or the kidney disease, the patients start to manifest these symptoms. These include nausea, vomiting, bad taste in their mouth, or a metallic taste in their mouth. Some patients will say that they just have no energy, they feel drowsy throughout the day, and these are the signs that indicate that there is enough waste product that has built up in the body, that it's risky, and there can be further complications related to toxin buildup, and patients can even have seizures and complications like death. We discussed how kidneys keep electrolytes and chemicals within normal range within the body. So when kidneys get damaged, these can go haywire. So your sodium, potassium, calcium, phosphorus, all these can go out of range when kidneys are damaged. We also discussed that kidneys produce hormones, including renin, vitamin D, and erythropoietin. So if the kidneys are damaged and not producing these hormones, our bodies can develop high blood pressure, our bones get weaker, and there is less erythropoietin production in the body. That results in patients getting anemic, and so their hemoglobin levels in the blood will drop. Now, if you have any of these signs or symptoms, definitely seek care, definitely go see a healthcare provider, get your blood tested, get your urine tested, and see if there are any early signs of kidney disease. One important thing that I would like to add is that a lot of these signs or symptoms may not manifest until much later on in the course of the disease. There are about 80 million individuals in the United States. That's about 1 in 3 individuals that are at risk for chronic kidney disease. And unfortunately, there are no set guidelines as to how often should individuals get their blood tested for kidney disease. So if you do have risk factors for kidney disease, including diabetes, high blood pressure, or you have family history of kidney disease, definitely get your blood and urine tested at least every year and make sure you're not starting to have any signs of kidney issues. Early care, early detection is important so that appropriate treatment can be started before there is permanent damage and scarring in the kidneys. I hope you found this video helpful. If you did, like and subscribe. You might also find my other video helpful, which is about medicines that can damage the kidneys and that you should avoid when you have kidney problems. So if you want to watch it, click on the link here, and I will see you in the next video. Until then, goodbye. Stay healthy.